Welcome to Franciscan Physician Network. Meet one of our doctors.
Hi, I'm Ann Hunley Davis, MD. I graduated from Eastern Virginia Medical School in Virginia and then did residency at Hinsdale Hospital. Since then, I've worked in federally qualified health center for a couple of years, and then I worked in the prison system for a couple of years. And now I'm going to be a family medicine doctor working in an outpatient clinic here. The great thing about family medicine is that it's impossible to get bored. Because you see a little bit of everything. You take care of the entire person, and every person is an individual. And so every patient encounter is an individual. You're never taking care of diabetes, you're taking care of Mr. Smith who has diabetes. And of course, Mr. Smith also has a whole set of life experiences that you're taking care of too. And so each encounter is different and unique in and of itself, and is very fulfilling to kind of go through that way. I think that my most important care philosophy is kind of what I was saying about each patient being an individual. It's very important. I think it's important that patients aren't too hard on themselves and that they view their health, their medical health, as part of a general sense of well-being and of wellness. That being a healthy person isn't just not having a disease or having a disease that's well managed, but it's also building healthy habits. It's having healthy relationships. It's having a healthy self-assessment and a healthy idea of who you are and where you fit in the universe. And I think that that's really important to assess at every visit, is the patient's wellness and not just their disease. I think a variety of experiences have helped a lot. I think that being in a prison situation in particular, not really knowing what's coming at you and kind of reacting to situations has been helpful. I think just to the more people that I interact with, whether it's medical assistants or nurses or other doctors or patients, every encounter teaches me new things, and it's really important for me that I keep myself open to that and to that I will be learning from everyone and from everything that I experience. My patients in general like that I'm trying to interact with them as a person and not just as a patient. And I think that came across even more in prison than it does in the rest of the world, but it happens other places too. I think our medical system can be very dehumanizing, and so that people come to talk to me and they say, wow, it's actually like talking to a person. And I like that about myself, and I think that people like that about me. Well, I'm a member of St. Clement's Episcopal Church in Harvey. We have a food pantry there that I help with when I can, though that can't always because of the way schedules work out, but I am very active there. I also like to do a lot of different kinds of crafts, scrapbooking, and I sew and cross stitch and that kind of stuff. Have 2 dogs and a cat and a fish tank. To not be too hard on yourself. I think that it's easy for us to say, oh, well, I really shouldn't have done that. I ate that milkshake and it just blew my diet for the week. Or, oh, I missed my pills and now my blood pressure is going to be 1,000,000 all day, or whatever it is. And I think that it's very, very important that you congratulate yourself for every good decision you make, in addition to kind of beating yourself up a little bit for the bad decisions you make, and to look at all of your decisions as a whole and say, well, you know what? Yeah, I ate a milkshake. I shouldn't have eaten a milkshake, but I had a salad for lunch. I had a Diet Coke earlier. Here are the other good choices that I made. And I think that's very, very important, because when we beat ourselves up, what happens is that we start to get discouraged, and then once you start to get discouraged, all of your good choices just go away. And if you're anything like me, then you get discouraged and you eat another milkshake. And so it's just very, very important that you love yourself and that you care about your own well-being and your health.
Franciscan Physician Network, a division of Franciscan Alliance, is one of the largest and most respected physician networks in the Midwest. Together, we're inspiring health in our communities by caring for you and your family throughout every stage of life. For more information, go to www.franciscandocs.org or call 708